Hello, good morning. This is Professor Dr. Ramesh from Fortis Hospital Chennai. Today we will be seeing a very interesting case of a lady who's come from Nigeria, Lagos. She's 64 years old. Her name is Odigie. She had seen me about almost 15 years ago. I did a hip resurfacing for her. Hip resurfacing is when you just replace the surface of the femoral head, and then unfortunately, as you all know, that the hip resurfacing failed worldwide by the ASR, the debut Johnson & Johnson. So she had to be recalled, and then almost say 5 years I had to do a total hip replacement for her. I used debut total hip in the form of a Pinnacle cup and a Zoe stem, which was rock solid, and she did very well for almost 10 years, and then which was done in 2012, and then she came back to me in this last month to Fortis Hospital Vadapalani, where I am now a senior consultant. What was interesting was that the cup had gone beyond the acetabular floor. The cup had gone into the pelvic cavity, and it was lying inside the pelvic cavity, and the stem it didn't look loose at all on x-rays and on CT 3D reconstruction films. But we have to be prepared, so I was prepared to revise the stem if I found it loose on the operating table. So here was a condition where the acetabulum had gone into the pelvic cavity with the pelvic discontinuity seen on CT films, and I had to do a lot of preoperative planning. My preoperative planning was to remove the acetabular cup and then seal the base of the acetabulum with vical meshes, put a lot of bone graft into the acetabulum. I had got the cancellous bone chips from Ramesh Medical College in Bangalore, and then I had to probably if I had kept two options. If I'd got a good acetabular rim fit, then I would have put a multi-hole cup with an acetabular augment. But in this case, the rim fit was not good. And so luckily I had requested Link company from Germany to keep the acetabular shells up to the size of 66, as she's a big lady from Nigeria. I was able to get I was able to get an acetabular shell to the size of 62 millimeters. So with the vical mesh in and with the bone graft nicely packed in, and then I fixed the acetabular cage, which is 62 millimeters, fixed it with which went around the operator foramen, and then fixed it with about 6 cancellous screws of 6.5 millimeter. I got a very good fixation of the acetabulum. Of course, preoperatively, I also did a CT angiogram and also made sure that there's no aneurysms or anything in the abdomen, because the pelvis had gone, because the cup had gone into the acetabulum. Once the cup was fixed and I put in a 36 poly D liner inside, I found that the stem was also loose. So rather than going and rushing and doing ETO or a trochanteric osteotomy, I tried to remove the femur with the help of the slap hammer, and to my joy, the femur started coming out. It came out with the tip of the GT. So then I decided to go in for a distal fitting debut solution stem, 250 into 15 bowed solution stem, long stem, which went in nicely. And then I used a cerclage wire around the LT as a protection, and then fixed the GT with the help of cerclage wires through holes in the solution stem. Was able to get a good reduction. I used a ceramic head for 36 mm ceramic head to the solution stem, plus 8.5 mm as the offset. And the hip stable, got a very good reduction, good range of motion, washed the joint, and then gave nice double breasting sutures, and then transferred her to the postoperative care. I have now shared the x-rays with you in the preoperative and the postoperative to you. So this shows that you need to do, the case is being presented for the simple reason that you need to do a lot of preoperative planning, because as you do a good preoperative planning, half the job is done. Just like you build a house, if you plan well, the house will be built well. Similarly, I did a lot of preoperative planning as to how to build the floor, how to keep the sizes, because it is very important. Because if you ask the link company to give you the established shells, they stop in India at the size of 60. I requested them to bring sizes up to 66, which was available in Mumbai. So you had to do that preoperative planning. Again, similarly for the DePuy cup as well, I requested them to keep up to size 66. I was even looking at trying to do three-dimensional imaging in order to CT imaging to prepare a special acetabulum, but the cost was going up. So I think this was a very good result which I achieved, and we also have to be cautious, and that's why I did the angiogram to make sure there's no aneurysm, nothing there, so I didn't need a vascular surgeon, and made sure that I had enough bone graft, although we don't have a good bone bank in Chennai, so I had to get the bone graft from Bangalore Ramaya Medical College, prepared the vical shell, vical mesh. So it was a lot of planning, and I had kept the stem ready, even though the stem was firm in the X-rays and CT. So the point I'm trying to make here is you need to do a lot of preoperative planning, a lot of have all your gadgets ready, and when you have everything, then you can give an excellent result. The good news is I was able to make sure that she did not have any limb discrepancy post-surgery. She is able to stand straight and walk. You can now see the video of the patient walking. She is almost now a month since surgery. She wanted to stay in a hotel for about 2 weeks after getting discharged, so that the operated wound and everything is healed well, and she's independent with the walker, and she's very happy to go back home to Nigeria now. And I'm sure that many foreign patients will be happy to come to Chennai, come to Fortis Hospital Vadapalani, because we not only have the expertise, the medical expertise and the medical knowledge of how to treat such patients, but we have an excellent theatre facility and an excellent ICU and post-operative care, good physiotherapy, and a very helpful management, which helps to give what we need in order to produce very good results. Thank you very much.
Good morning, my name is Patience Ojienehibhajie, a Nigerian that came for hip replacement third time in Chennai, Fortis Hospital Vadapalani. And my surgeon, Dr.Prof. Ramesh, had the third hip replacement done. The surgery was successful, and I've been ambulating, for a few days. I had good physiotherapies because I'm working well with the walker, and the pains are subsiding. So right now, I'm grateful to all of them, the doctor, the physio, and the international lady that be coordinating. They have been on ground, and I'm happy that I'm fit to fly back to my country today. So I'm grateful to all of them. More experience can be shared from my sister, who is beside me.
Well, she has said it all. I'm her sister, and my name is Grace Isekagbe. I'm from Nigeria, residing in Lagos, and I'm here with her. And since we've, as she has said, for the third time, she's replacing her hip, and the experience was very interesting in the sense that the surgery was successful, and then the pains subsided gradually as the doctor in charge, Mr. Ramesh, very effective and efficient. He is always out, and whatever he says, he makes sure people follow his instructions and his needs. And these instructions has really helped us. We follow up all what he says, and it has been very great. And we can see that in how my sister is improving on a daily basis. Gradually, the physio, Mr. Briani, is very also much up and doing. He comes every day since we left the hospital for the guest house. He comes every day, and he's been very, very efficient, and that we can see. All in few days, my sister was able to maybe a little bit calm the water. So our lady Shumaila, very effective and very friendly. She's always up and doing. She's always there. And whenever maybe we have issues of getting money and we panic, she's always there to calm us down and tell us, don't worry, you will get your money, things will be okay. And this has made us feel at home with her, because each time I also call her, you are my friend. A little time I wanted to pick up, she was there with me and was saying, no. So I would say, oh, very good, you are my friend. And when she came with Vanessa, I told Vanessa that this is a very nice girl. She's always up and doing. And whenever you call her, she doesn't frown, she's there. So with all this hospitality, I will not leave out our nurses in the Fortis hospitals, Vadapani hospital. The nurses there and all those housekeeping, oh lovely, they are wonderful. They always come and chat with us and clean the place 1001 time. They come very friendly and say, have you eaten? Do you have any need? Call us. So they are very, very up and doing. If only those sets that looked after us can be upgraded, because they did very well and they made us happy. Even to the extent when we were parking here to the guest house, one of the ladies there followed us. I can't remember her name. I think Mr. The physio, Mr. Pirani, knows the name. She was so attached to us and very friendly, and I felt it. I felt the love. Yeah. So this, I would say, the crew that looked after us in that place They really did very well, and they should be recognized. Mr. Pirani, number one, followed then Shumaila, and then above all of them, Dr. Professor
Mani Ramesh.
Dr. Professor Mani
Ramesh.
Ramesh. So he's wonderful. I think he has a lot to teach. He has a lot to give. He has that experience, and he's very rich in experience. So the way he manages human being is wonderful. So I would say thank you to Dr. Professor Mani Ramesh. Thank you to Physio Pirani. And thank you to my friend Shumaila, the hardworking lady. And thank you to everybody that helped me to take care of my sister, and I can see she's improving on a daily basis. It's wonderful. It's wonderful because there are people that undergo such surgery, but they don't pick up immediately. But she gradually and fast. So that gives me joy. And also, it's not only me, that shows the handwork of the crew headed by Dr. Mani Ramesh. Their good handwork, that shows their efficiency. Thank you all.
Hello, my name is Dr. Pranav. I am the HOD of the physiotherapy department in Fortis Hospital. Recently, one patient we received, it was operated by Dr. Mani Ramesh. Patient came all the way from Nigeria, and patient came here for the revision hip replacement on the left hand side. And patient is very apprehensive. Patient was very heavily built, but very remarkable surgery was done by Dr. Mani Ramesh. And after the surgery was done, from the next day onwards, the role of the rehabilitation came into play the role. And according to the instructions of Dr. Mani Ramesh, we started the physiotherapy session. The challenges were patient was very heavily built, and patient also was having a fear of pain, that she won't be able to do the rehabilitation process. She will take some time to get back on her feet. But with the help of proper physiotherapy and the instructions of Dr. Mani Ramesh, we could follow the proper rehabilitation process, which helped the patient to walk, to do the exercises properly. And after, let's say, a couple of sessions, she's back on her feet now, completely pain free. She's able to do all her daily routine by her own, which is a remarkable achievement. And it says that it gives an idea of how nice the surgery was done by Dr. Mani Ramesh. And here in Fortis Vadapalni, we have a very nice setup of physiotherapy. We do the rehabilitation of all sorts of things: orthopedic rehabilitation, neurological rehabilitation, cardiothoracic rehabilitation, and we have OPD services as well, and IPD services also we do have here. Thank you.